everyone, my name is Alyssa, and my project topic is examining the relationship between eating disorders and female athletes. First, we'll start with a brief background. In general, there are three main types of eating disorders. These eating disorders include anorexia nervosa, which is defined as having a distorted body image with unwarranted fear of being overweight. The symptoms include trying to maintain a below normal weight through starvation or too much exercise. The next type of eating disorder is bulimia nervosa, which is defined as an eating disorder characterized by regular, often secretive bouts of overeating, followed by self-induced vomiting or purging, strict dieting, or extreme exercise, associated with persistent and excessive concern with body weight. And finally, there is binge eating disorder, which is defined as frequently consuming unusually large amounts of food in one sitting and feeling that eating behavior is out of control. The reason why eating disorders are related to female athletes is because female athletes are at a high risk of developing an eating disorder due to high pressure to maintain their body and their weight. Next, we will discuss the public health impact on eating disorders and female athletes. An eating disorder is considered a psychiatric disorder. Eating disorders can be fatal. In fact, more individuals die from anorexia than any other psychiatric disorder. Athletes that have an eating disorder can experience dental problems and issues with sleep. They can also experience skeletal system complications, such as being at a high risk for developing osteoporosis and increased prevalence of developing fractures. Also, athletes with an eating disorder can experience reproductive system complications, such as lack of menstruation. And lastly, depression and anxiety often occur with an eating disorder and can either precede or follow the disorder, which can further complicate the treatment of this illness. Next, we will discuss the epidemiology of eating disorders and female athletes. Disordered eating impacts 62% of female athletes. Athletes who struggle with disordered eating are 8 times more likely to be injured. Athletes in aesthetic/lean sports may report higher levels of eating disorder psychopathology. And lastly, athletes with low energy availability were more likely to have metabolic, bone, cardiovascular, gastrointestinal, immunologic, and hematologic issues. The above statistics show how much of an impact an eating disorder can have on an athlete's mental and physical health. Next, we will discuss what experts are currently concerned about and are working on. Eating disorders can be developed from low self-esteem and repeated comments about one's weight and body. So some interventions that are used include prevention programs, which include focusing on preventing the onset of an eating disorder by avoiding triggers, such as making negative comments on an individual's body, weight, and diet. Next is the health promotion approach. This is utilized by creating a supportive training environment for the athlete. Next is focusing on building self-esteem. Low self-esteem can lead to the onset of an eating disorder, so by building self-esteem, this can limit the potential for the onset of an eating disorder. And lastly, focusing on protective factors to prevent the onset of an eating disorder. Finally, we will move on to recommendations. Some recommendations to avoid the trigger of an eating disorder within an athlete include: coaches should avoid weighing their athletes, making comments about the athlete's weight, making comments about what the athlete is consuming, and giving advice about diet and weight loss. All of the above could be wrongly interpreted by the athlete and can lead to the onset of an eating disorder. Some ways for coaches to prevent eating disorders would be the implementation of required trainings about eating disorders, the effects of eating disorders on an athlete's mental and physical health, and lastly, how to avoid inducing an eating disorder. Here are all the sources that were used for this presentation. Thank you for listening.